allow me to focus on some non-COVID related issues, which also have profound impact on the county government. The first one is the disbursement of equitable share allocation to the county government. Surprise, surprise. You will recall that in my last week's press statement, which I made on Monday 14th June 2021, I emphasized that the National Treasury owned the counties Kenya shillings 102.6 billion 2 weeks to the end of the financial year, which was unacceptable. That message reached the National Treasury, and the Cabinet Secretary have failed 8 counties 4.47 billion the same day of the said press statement. And I'm grateful to the CS, National Treasury, for his immediate action. That is not all. Earlier today, an additional 39.244 billion was dispersed, bringing the equitable share balance onto the counties to 58.906 billion. Owed. For this show of goodwill by the National Treasury, I once more wish to thank CS Yatani for this show of goodwill to our request and to the county government. In respect of the 58.9 billion still owed to the counties, we request him to release it next week so that the counties can utilize it to pay the pending bills during the next 10 working days, provided that the National Treasury clears its outstanding dues to the 47 counties in respect of 2020-2021. So we have 3 days in June, working days, and 7 days in July, going up to 9th September. May I also say that an additional 4.236 billion has been dispersed to the counties by the National Treasury, which is actually conditional grants. We are not counting it as among the 58 because those are allocated dues. But this one is these are conditional grants. Non-payment of Linda Mama claims to county government. The resource strains on public health facilities is worsened by the fact that the facilities have not received disbursement for free maternity service over and under Linda Mama since October 2020. We therefore urge National Hospital Insurance Fund to expedite reimbursement to the public health facilities which have been offering free maternity services without getting any reimbursement. In conclusion, as I conclude, I would like to inform you that in line with the mandate of the Council of Governors to share information on the performance of the counties in accordance with Section 20B of the Intergovernmental Relations Act, I will deliver this year's State of the Devolution address on Tuesday, next week, 29th June 2021, at the same venue. The State of Devolution address, known as SONDA, is an annual event organized by the Council of Governors as a platform to give an account of the achievements, milestones, and challenges of the county government over every financial year. Like the State of the Nation addressed by the President, it also gives information about the budget allocation in various devolved sectors, the challenges experienced and measures being taken to improve service delivery. Asanteni sana, be blessed. That's it?
Questions? Yes.
Yeah. Mm-hmm.
Now with the current situation that the government, the National Treasury has added in some more,
Mm-hmm.
do you still stand by your position that you are going to shut down counties?
Absolutely not. It's the first time I've congratulated Cabinet Secretary Atan, and he deserves it. He has been very sensitive this time around. And you know, I was having a hard time convincing my speech writers to put that photo of thanks there. And there was resistance. But you know, as a Christian, I must thank people when they do well, isn't it? So we are happy. We have funds to at least buy essential things like medicine and also pay salaries. But the money owed, we are still going to follow it up, use diplomacy this time around, so that if we get it, then it will fulfill what is said during the budget in Parliament, that we pay pending bills. The 58 billion remaining, that can be used from next week up to 9th July. A special provision for us to pay the bills. So that will be our final request for this year. But meanwhile, the counties are busy now spending, and spending well. Any other question? Yes, please. Stop. Mahaba. I've not heard you. Can you just temporarily? May I put it this way? The members of the council who have the capacity, who have the fund, they have to liaise with the Minister of Health, MOH, and also KEMSA, the newly constituted KEMSA, where even the Council of Governors is now represented. We have appointed a representative in KEMSA now, and they have begun working. They would have now to liaise with MOH and also KEMSA, those who want to go that route. But it's not easy. As you heard from the chairman of vaccination committee last night, it is not easy because this thing is they are still in short supply, let's face it. And at this stage, let's leave these matters to the Minister for Health to continue talking to our good friends overseas, the Danish, the Americans, and he's doing a good job. We are going to get more medicine, even Pfizer. And he'll clarify more because I understand he's addressing you this afternoon. He will clarify you that more. But it's not a policy of the Council of Governors as yet. I'm meeting the governors on 29th during the address of the State of the Devolution, and we shall also have a meeting, an extraordinary meeting with them on 30th, after which we shall meet the cabinet secretaries going forward so that we work as a team. So we shall explain these issues further. Very good. May I release you to go to the next meeting? Go ahead.
Yesterday, the big region governors, we wanted to give them a Kiev international government to import the
No, that's what he asked. That's what he asked. He has asked, and we are saying it's not a policy. Those who have money, let them liaise with the Minister for Health and KEMSA.
Kwa hivyo hatutakosea tukiandika kwamba hukubaliani na wizi wa baadhi ya magavana walianza kwamba wanataka kupata fursa ama kibali.
No. I have no problem. I have actually no problem with that request. All I'm saying, let them tie up with the Minister for Health, Mr. Waziri Mutahi Kagwe, and KEMSA, so that it is coordinated. That's all. It's a good thing. If I had money, I would also request. But the rest of us will just wait for these free gifts which are coming forward.
Thank you very much.
Yes, thank you. And thank you for your patience.
at least the governor has congratulated the treasury for at least disbanding the cash. Remember last week the Council of Governors had threatened to shut down all the county activities, and right now, as you can see, the already Governor Wambura has already talked about the 4.7 billion that was dispersed into the counties, and the amount that has remained owned by the treasury is 58.9 billion, and that amount, the amount that has already been disbanded, will be used from next week to 9th July. So at least the facilities that the Council of Governors was a bit afraid of being shut down include the free maternity care to the counties, and at least from today, from next week to 9th July, all the counties will be able to use the cash. And the governor has also talked about the annual press briefing that is going to take place next month, at least so that all the governors are going to share the milestone, their challenges that they have been facing through all the financial years. So we'll keep you posted, we'll keep you updated. So at least we can get to know how the county government, the Council of Governors, the county government are going to use the cash. And also remember, yesterday the Council of Governors, the governors from the Lake regions, they talked about requesting the national government to be able to be facilitated their own COVID-19 vaccines, so that they can be able to curb so that the Council of Governors requested at least the COVID-19 vaccines to be facilitated to the counties. This will help in curbing the number of COVID-19 cases, because remember the 13 Lake Region counties were locked out, and at least we are going to see that if the proposal will be successful, the COVID-19 numbers will reduce, and all the Council of Governors are going at least to be grateful to the Treasury, so for the disbursement of funds. So we'll keep you posted and we'll give you more updates. Thank you. And,